Rabies is one of those diseases that everyone has heard about, but not everyone understands just how serious it can be. Simply, rabies is a deadly virus that attacks the central nervous system, specifically the brain. The virus primarily spreads through the saliva of an infected animal, most commonly through a bite, but it can also be transmitted if infected saliva comes into contact with open wounds or mucous membranes, such as the eyes or mouth. The virus can infect any mammal, but certain species, like dogs, bats, raccoons, skunks, and foxes, are more likely to carry it. Once a person or animal is infected, the virus travels through the nerves to the brain, causing severe inflammation and leading to death if untreated. In many parts of the world, rabies is still a significant public health threat. It's estimated that rabies kills around 59,000 people globally each year, with the vast majority of cases occurring in Africa and Asia. Dogs are responsible for about 99% of human rabies cases. However, in many developed countries, rabies in humans is rare due to widespread animal vaccination programs and the availability of post-exposure prophylaxis treatments. In the United States, for example, human rabies cases average only 1 to 3 per year, primarily due to encounters with wild animals like bats, raccoons, skunks, and foxes. Causes of rabies. Like what we said, the most common way for humans to become infected is through the bite of an infected animal. The virus is present in the saliva of infected animals, and it gets transmitted when the saliva comes into contact with the bite wound or a mucous membrane such as the eye or mouth. While bites are the most common mode of transmission, scratches from infected animals can also lead to infection if the animal's saliva comes into contact with the wound. It's important to note that rabies cannot spread through casual contact, like petting an animal or being near one that has the virus. It requires direct exposure to the animal's saliva. Certain animals are more likely to carry rabies than others. In many parts of the world, dogs are the main source of infection in humans. Wild animals like bats, raccoons, skunks, foxes, and wolves are also common carriers. Other animals that can also carry rabies include cats, cows, horses, rabbits, and goats. It's important to remember that even if an animal doesn't seem sick, it can still carry and transmit the rabies virus. Once the virus enters the body, it travels through the peripheral nerves to the central nervous system, eventually reaching the brain. This process can take weeks or even months, which is why there's a window of time for treatment before symptoms appear. Once the virus reaches the brain, it replicates there and then spreads to other parts of the body, including the salivary glands, which is why it is transmitted through bites. Symptoms of rabies. One of the most dangerous aspects of rabies is that its symptoms can take time to appear, but once they do, the disease is almost always fatal. The incubation period, or the time between exposure and the onset of symptoms, can range from a few days to several months. However, in most cases, symptoms start appearing within 1 to 3 months after exposure. Rabies symptoms can be divided into several stages. Number 1. Prodromal stage. In this early stage, which typically lasts 2 to 10 days, people may experience flu-like symptoms such as fever, headache, and fatigue. There may also be itching or tingling at the site of the bite. These symptoms are easy to mistake for a minor infection or even a common cold, which is why rabies can go undetected in its early stages. Number 2. Acute neurological stage. As the virus spreads to the brain, more severe symptoms appear. Individuals may experience extreme restlessness, hallucinations, agitation, and difficulty swallowing. A telltale symptom of rabies is hydrophobia, or fear of water. This happens because the muscles involved in swallowing become paralyzed, making it painful to swallow liquids. Due to this inability to swallow, people with rabies often drool or foam at the mouth. In the later stages, people with rabies may also become progressively weaker and experience paralysis, starting at the site of the bite and moving toward other parts of the body. It's worth noting here that some people may experience a form of rabies called dumb or paralytic rabies, where paralysis is the dominant symptom rather than the more commonly known furious rabies, characterized by hyperactivity and aggression. Number 3. Coma and death. Without immediate treatment, rabies is almost always fatal once neurological symptoms appear. The individual may enter a coma and experience cardiac or respiratory failure, leading to death. Diagnosis of rabies. Diagnosing rabies can be tricky because early symptoms are so similar to those of other viral infections. If rabies is suspected based on the patient's history of potential exposure, such as a bite from a wild or unvaccinated animal, several diagnostic tools can be used. In humans, rabies can be detected through tests of saliva, blood, cerebrospinal fluid, or skin biopsies. However, these tests are often more effective or definitive after symptoms have appeared, which is why rabies is often diagnosed based on clinical symptoms and the likelihood of exposure. For animals suspected of having rabies, diagnosis usually involves testing brain tissue, which can only be done after death. In many cases, animals that have bitten humans may be quarantined and observed for signs of rabies for 10 days. If the animal remains healthy during this period, it's unlikely that they were infected at the time of the bite. Treatment for rabies. The key to surviving rabies is immediate treatment after potential exposure. This treatment is known as post-exposure prophylaxis. Post-exposure prophylaxis consists of a series of injections. Number 1. Rabies vaccine. The rabies vaccine is typically given in 4 doses over 14 days, with the first dose given as soon as possible after exposure. This vaccine helps your immune system produce antibodies to fight off the virus. Number 2. Rabies immune globulin. In cases where the exposure is high risk, such as a bite from a wild animal, a dose of rabies immune globulin may be injected directly into the wound. This provides immediate antibodies and protection until your body starts producing its own antibodies. It's crucial to note that PEP is nearly 100% effective if administered promptly and correctly. This is why seeking immediate medical attention after a potential rabies exposure is so important. Once clinical symptoms of rabies appear, treatment becomes much more challenging, and the prognosis is generally very poor. There is no specific cure for rabies at this stage. Treatment focuses on supportive care, which may include sedation, pain management, anticonvulsant medications, and mechanical ventilation. In 2004, a treatment protocol called the Milwaukee Protocol was developed, which involved putting the patient into a medically induced coma and administering antiviral drugs. While this protocol has saved a few lives, its effectiveness is still debated in the medical community, and it's not considered a standard treatment for rabies. Prevention of rabies. The good news is that rabies is largely preventable. There are several steps you can take to protect yourself, your family, and your pets from rabies. Number 1. Vaccinate your pets. One of the most important ways to prevent rabies is to ensure your pets are up to date on their rabies vaccinations. In most countries, this is required by law for dogs and cats, and for good reason, as pets are often the bridge between wild animals and humans. Number 2. Get a pre-exposure vaccination. For people who are at higher risk of exposure to rabies, such as veterinarians, animal handlers, or travelers to areas where rabies is more common, pre-exposure rabies vaccination is recommended. This vaccine provides long-term protection and can help reduce the severity of infection if exposed. Number 3. Avoid contact with wild animals. While it may be tempting to approach or feed wild animals, especially in natural parks or rural areas, it's best to keep your distance. Wild animals like raccoons, skunks, and bats are more likely to carry rabies, and even a seemingly tame animal can bite if it feels threatened. Number 4. Secure your trash. Animals like raccoons and stray dogs are often attracted to food in trash cans. By securing your garbage, you reduce the chance of attracting potentially rabid animals to your home. Number 5. Bat-proof your home. Bats are a common source of rabies in many regions. To protect your home, ensure that windows, vents, and other openings are sealed, especially in attics where bats might nest. If you find a bat inside your home, contact animal control or a wildlife expert to safely remove it. While rabies is a deadly disease once symptoms appear, it's also entirely preventable with proper precautions and timely medical intervention. Now, we want to hear from you. Have you or someone you know ever had a close encounter with a rabid animal? How did you handle the situation? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.